by my colleague, Jamie Kuznicki.
Hello, this is Jamie. I also work at the Reproductive Health Supplies Coalition here in DC.
Okay, I'd like to thank everyone for joining us today for our webinar on AccessRH. We are excited to continue our series of webinars introducing the Coalition's tools and resources. For those of you who are unaware, the AccessRH began as an idea from the System Strengthening Working Group dating back to 2005. It has since grown from an idea to a potential solution to a proposed concept, and now, since 2009, into a procurement service provided by UNFPA to the reproductive health community. So today we're joined by our colleagues from UNFPA Copenhagen, and they will introduce themselves, and they will be leading today's session. We'll start with a PowerPoint overview, and we'll then have time for question and answer at the end of presentation. Just so you know, we've put everyone's phone on mute during the presentation so we can all hear our speakers. So please hold your questions until the end. At that point, we'll explain how the question and answer period will be managed. And so with that, I'd like to turn it over to UNFPA.
Thank you very much. So my name is Priscilla. I'm calling from PSB UNFPA here in Copenhagen. And I have Chris and Celoy here with me. I'm going to start with the presentation by giving a quick overview of the AccessRH and the changes that have been grown through the last few years. And then I'm going to pass it on to Celoy to go on with the quality assurance perspective, and then Crescentia, who's going to give us an overview of the procurement aspect of the AccessRH as well. So I'm going to start with, one second. Yeah. So I'm going to start with a brief history of AccessRH, where everything has started, where we are now, and what has happened in between. So as we can see in the timeline, in the timeline here in the slide, everything has started in 2005, when the challenges related to procurement and reproductive health were defined. Among the main challenges we had was the lack of access, access to basic contraceptives, long lead time for production, and a weak quality assurance process, and of course, unpredictable funding. It was then in 2006 that the solution was developed by stakeholders and consultants, and that was, as we can say, maybe the birth of AccessRH. In 2008, the concept was developed and designed, and then stakeholders approved and selected UNFPA as the implementer of this whole platform. In 2009 was when the proper design and the proper design has started, and that's when we have secured funding for 3 years. That's when the whole thing came together. So fund came from BMZ, the European Union, the Gates Foundation, and USAID. Finally, in 2011, that was when the AccessRH procurement service was launched. In 2012, we launched not only the AccessRH catalog, but also other very interesting tools. It was then that AccessRH was nominated by Woman Deliver as one of the top 25 Inspire innovations of the year that helped to improve the conditions of girls and women around the world. It was not far, like it was in 2013, sorry, that the UNFPA integrated AccessRH into PSB business structure. And then recently we have also signed a UNFPA and World Bank agreement to provide more coordinated procurement, build local capacity, and like that also altering the way World Bank disperses funds. We are now in 2014 and working towards a new agreement with Global Fund. So finally, so what is AccessRH? So AccessRH is the UNFPA procurement and information platform for reproductive health commodities, for emergency items, and for census supplies. AccessRH enables organizations to work with reproductive health, with family planning and census to make the best use of the limited resources, by delivering quality supplies and in a cost and efficient way. Here we can see the AccessRH mission, and then the AccessRH mission is building three solid foundations, and then AccessRH mission is building three strong foundations. One of them being improving the access to reproductive health commodities, in raising the liver performance, and to improve the supply chain information altogether. Here we have highlighted our partners in the whole development of the whole project. You can see that we have Ministry of Health partners, we have NGOs, other UN organizations, and of course some of our UNFPA offices around the world. Here in this next slide we can see the number and then how many clients in different countries we have served. The number, the color indicates the number of clients, the number of repeated clients we have in each country. For example, in Congo DRC, we have had more than 6 different clients using AccessRH as a platform to acquire their contraceptives or family planning supplies and other commodities. And you can see that we have been spread all over the world, and today we are represented in we have more than 136 clients, and we have provided service to more than 88 countries throughout the last 4 or 5 years. Here we can see the type client, the client type distribution from 2011 to 2014. We can see that most of our orders have been placed by Ministry of Health, by governments themselves. They represent more than 50% of our clients. Right after comes NGOs, and they represent 24% of our clients. Here we can see the number of couple years of protection AccessRH has provided in 2013. You can see the difference between the years 2011, 2013, 2012, and 2013, and where we are right now. So through an open and transparent process, we provide safe and reliable commodity at a highly competitive price and decrease the waiting time for key contraceptives held in stock. This is the base of AccessRH, and you can see through the slide here, transparent process. That's what guides us through everything we do. And we have the quality assurance perspective. We have the value for money and time saving. Those are the guidelines. Those are what built the platform as such. UNFPA adheres to public procurement principles. By conducting competitive, transparent, and bidding process, UNFPA creates long-term supplier agreements. We're going to be talking a little bit more about what these long-term agreements are. But here prices are defined, pre-qualified supplies are selected, and then everything is available in our platform, in our catalog. And this is very helpful and helps our partners to make the best procurement decision to meet their needs. And it's important to highlight here that this is not only if they procure through UNFPA, but this is the catalog. It's open for everyone. You don't need to log in as such. So whether you're procuring through UNFPA or not, this is a very good indication. You can compare price, you can look at timelines, you can look at manufacturers, you can look at registration. So there's a whole bunch of information that you can look in our catalog, whether you use our service or not. For the ones that have used our catalog before, you'll see that our catalog has been redesigned, And here the new features and the new layout. The AccessRH website now looks, it's divided in two sections, if I can say. So that's the information side of it, and then there's the procurement service part of it, if you can see from my slide. So the menu is very, what is important to highlight here as well, I think, is the sections that are dedicated to humanitarian supplies and capacity building, two functions that were not there before. It's also very easy to navigate through the menus and provides an interactive tool, including lead time calculator and budget planner. The website is also available in English, French, and Spanish. One important thing as well is that our catalog and our information available, the information available to AccessRH, it's continuously being updated. So everything you see there, that's the latest. That's what has. That's the latest information we have over here as well. So once you have the chance, please visit our website, browse a little bit around, and let us know what you think about the new design and the new features. We are not online right now, but it's I cannot show exactly how the catalog works. But if once you have the chance, just please go to myaccessrh.org/product, and you come to our catalog, and you see how interactive it is. Here you can have information from different contraceptives, medical devices, pharmaceutical kits, and much more. And you can see here on the left side, like the categories and the subcategories of the product. So just spend some time browsing around, clicking around, and then you see like how useful this information is. We also have, and for each of these categories and subcategories, we have product specification, we have lead time, we have images, we have estimated prices, we have registration information. So it's really useful, and especially at the planning stage, I think it's a very detailed tool that can be used. And here's what the product catalog contains. You can find information for more than 40 types of contraceptives, 18 types of reproductive health kits. We have midwifery and fistula repair kits. We have medical equipment items, pharmaceuticals, and humanitarian emergency and census products available there as well. Another great feature that you can find in our new AccessRH catalog website is the budget planner. Here you can type. You can plan in different ways. You can either type your total budget and see how many contraceptives of each kind you can have for that amount of money, or you can do the other way. You can say that you want to procure whatever amount of contraceptive, and then the tool will provide you how much money you need for that, including all the costs, like insurance, pre-shipment inspection, testing, and other related costs, associated costs with that. So it's very useful as well. You can type more than one contraceptive. You can type different budgets. You can, So again, when you have the chance, go around and have a look, because it's very, very useful for especially the planning stage. And also talking about the planning stage, we have the lead time calculator, what I think like most of our clients have found it very useful when planning their budget ahead or their year ahead. Here you can determine how long your order would take to arrive, determine port or airport. You can see how many weeks you have to wait for the production, how many weeks would take for the pre-shipment inspection, if pre-shipment inspection is required or not. And you can see the product manufacturing time, sample and testing. So it's very, again, very, very useful. Another piece of information that another tool that is very useful and provides lots of information is the RH interchange, or many times called RHI. And here is a platform, like it's a combined data from different donors, from different major donors for contraceptive orders, shipments sent all around the world. So right now we have information from more than 140 countries, and then this data reflects 80% of the contraceptives provided in the last many years. So again, it's very important. It's very useful as well if you want to plan or if you want to know what has been going to your country, what is about to arrive, how much has been spent in the last years, how much, who provided what. So again, please have a look in this information. This is this tool provides lots of information that can be useful at any stage, either planning or programming or implementation. So have a look. And here's like the contraceptive donors, like who we receive information from. So you can see most of the major donors in the contraceptive sector. So those are the ones feeding our database and allowing us to benefit from this data. And I think I mentioned a little bit how the tool can help us, but here you can see it provides the shipment history, what has arrived, what is coming. You can search by geographic area. You can search by, let's say, for instance, Africa, or you can look specifically in Nigeria or in Mozambique, or you can see all over the world. You can see the value in USA dollars. You can see who is funding, the quantity, and the sum of shipments all together. Thank you very much, Priscilla. Now we will go on to talk about the quality assurance of the reproductive health commodities that UNFPA procures. Priscilla has just given you an overview of the AccessRH as a tool, a planning tool, and ordering tool for your RH commodities. Now it would be good to know whether these commodities are quality assured or we just take them from the back of our houses. One of the pillars that we adhere to and that we promote in UNFPA, PSB, and UNFPA as a whole is that quality assured products are part and parcel of access to RH medicines. If the products are not quality assured, then we may not achieve the goals that we want to achieve in reproductive and sexual health. UNFPA applies stringent practices on the products, and these practices are based on internationally acceptable guidelines that are published in various documents, both for the non-hormonal commodities and the hormonal commodities. There is a process of pre-qualification, and this process is applied to both the supplier as well as the product that UNFPA would be intending to procure. As part of the quality assurance, we do conduct pre-shipment inspections, random sampling, and testing of the product. This may differ from product to product. However, each of the product categories, if you want more information, it is provided in the various quality assurance documents that UNFPA publishes. We have policies that cover different types of products that we procure. For male condoms, female condoms, and IUDs, we have a pre-qualification system which UNFPA manages. This pre-qualification is similar to the pre-qualification system that that WHO manages for medicines. That means the products are evaluated for quality, safety, and efficacy, as well as there are site inspections where these products are produced. We procure medical devices, emergency reproductive health kits, fistula repair kits, and these undergo technical evaluation, which has a predetermined specifications, acceptance criteria, and the assessment is performed by experts in biomedical engineering and other expertise as may be required. As part of the UNFPA QA policy, we do acknowledge that there may be some capacity building that is required for laboratories, national regulatory agencies, and manufacturers. Hence, UNFPA undertakes capacity building activities to help the various agencies to comply with the internationally acceptable quality standards. And some of these standards are actually published by WHO, UNFPA, and are also based on the International Standards Organization. As the manager of the pre-qualification scheme for the male latest condom, female condom, and the IUDs, UNFPA with its partners published specifications and the pre-qualification guidelines for procurement of these commodities. And these guidelines and specifications are available online. They go through in detail on what specifications these products have to meet before they are being considered for procurement by for pre-qualification by UNFPA. It takes you through who actually does the pre-qualification, what the qualifications of those people are, so that you can have an understanding of the whole system that these products are tested against before they are considered for procurement or even for pre-qualification. I'll briefly talk about the pre-qualification process, and that would include specifically the pre-qualification inspections. Pre-qualification of the male condom, the female condom, and the IUDs is an extensive process. It takes quite some time for a product to get pre-qualified, and it doesn't happen overnight. When a manufacturer submits an application, they don't get an approval the next day. It takes time because there is a process. The process starts by publication of an expression of interest by UNFPA, and this expression of interest is published on the UNFPA website, and manufacturers who are interested may respond to this expression of interest and submit the required documentation, which would have been stated in the expression of in the invitation to the expression of interest. The documents that are received go through an initial screening for completeness, and there is a step where the documents are assessed, and the assessment is done by experts in latex condoms, in biomedical engineering, who have had extensive experience in condom production or IUD production, and they go through a system of assessment themselves before they are approved to be experts for UNFPA, and then they can actually do the assessment. Once the product passes through the assessment stage, then this manufacturing site may be inspected by UNFPA experts, and the experts have to meet minimum requirements that are normally published when they are being requested to respond to a bid. And once if the site is approved, then there is sampling and testing, and the products are tested
against the approved specifications which are published, and a report and an outcome is given to the manufacturer. Once the product is pre-qualified, they have to maintain those approved specifications and other requirements throughout the pre-qualification period, and hence there is a re-inspection and pre-shipment testing to ensure that the manufacturer and the product continuously comply to the specifications as required. The UNFPA publishes a list of pre-qualified suppliers on the UNFPA website, which is open to the public, and this list is updated quite often. So it may be different. In January, the list may be different from what you saw in December. So it's important to keep checking that list when you are interested in placing orders. Please note that this pre-qualification scheme is not just for UNFPA procurement. It is also for other UN agencies, and is also being used by national regulatory agencies as well as national procurement agencies to ensure that they procure male condoms, female condoms, and IUDs that meet internationally acceptable quality standards. I've talked a little bit about the capacity building that UNFPA engages in. I'll zoom in now into the capacity building activities that we do in terms of quality assurance. Priscilla did mention that on my AccessRH there is a platform where you can check for registration of a particular commodity in various countries, and to ensure that we have more products registered in as many countries as we can, we support harmonization activities regarding registration of RH medicines. And this support, we have recently in the past supported joint assessment in the Southern African Development Community region. We have also supported activities of pilot joint assessment amongst Zambia, Zimbabwe, Namibia, and Botswana. We conduct in-country quality control laboratories on testing of male condoms. As you are aware, many countries do test male condoms in their national laboratories. Hence, we need to work together with these countries to ensure that we test these condoms according to similar, if not the same standards, internationally accepted standards. In the last 2 years, we've had about 5 in-country quality control laboratory training in Zambia, Kenya, Botswana, Ethiopia, and Tanzania, to name but a few. We've also conducted capacity building for national regulatory agencies with regards to inspection of male condom manufacturing sites. And some of the countries have also been involved in the inspections for pre-qualification of medicine, pre-qualification of male condoms with alongside with UNFPA experts. And going to now discussing about the quality policy for reproductive health medicines. The policy has now been in place for the past 3-4 years now, and it's time to do a review. And in this review, there's been new topics that have been included, and some of the topics are highlighted in the slide in front of you. The substandard, spurious, falsely labeled, falsified, counterfeit medicines. And it's very important that UNFPA has a clear statement on these types of medicines, because they can have a detrimental effect on the programs that countries and the UNFPA run. We've also included issues of monitoring adverse drug reactions and generic substitutions. Since 2012, UNFPA has engaged a system where the expert review panel based at WHO assess products for procurement prior to WHO pre-qualification. As you're aware, UNFPA procures medicines that are WHO pre-qualified. However, there may be cases where the WHO pre-qualified medicines are not enough to meet the demand that is out there. So in this instance then, an expert review panel which is managed by the WHO and coordinated from the WHO assesses some product based on a risk assessment criteria which is publicly available from the WHO website, and thus recommend which product may be considered for procurement or not. And this ERP mechanism is valid for products for 18 months, and during that period then procurement agencies such as UNFPA may procure those products for their programs. Excuse me. In the last 2 years, we've seen an increase in the number of generic RH medicines that are WHO pre-qualified. However, this increase has not matched the increase in demand of these generic medicines. Therefore, UNFPA is working tirelessly to improve the uptake of generic medicines around the world, including within UNFPA country offices and programs itself. We are building awareness among UNFPA staff and partners on multi-source generic products, and by this seminar we are also doing that, trying to build awareness of these products. We have redesigned the online catalog that Priscilla talked about to give prominence to generic names. So if you go onto the planning tool now on my AccessRH, you will see that you've got options of the different generic products as you plan for your procurement. We are currently also exploring the possibilities of standardized packaging to assure to just provide one packaging that does not distinguish between brands. This is just at exploratory stage. We are working with manufacturers to support them to register medicines in the family plan in 2020 countries, and this will facilitate uptake of generic medicines. We also, by providing support to NRAs, that is National Regulatory Agencies, on registration of reproductive health medicines, we are also sensitizing them to the generic reproductive health medicines. And so far, there has been good response from the regulatory agencies. We just thought we could just highlight that the difference between a generic and an innovator product. Innovator products are generally those products that were first authorized for marketing on the basis of documentation, efficacy, and safety. So this is through a company that would have designed the particular molecule or the product at the time. And then the generic products are the ones that are usually intended to be interchangeable with the innovator product, and they also go through the same efficacy, the same assessment of efficacy, safety, and quality. And brand name is a name that is given by a manufacturer. And for pharmaceuticals, a brand name, a generic product and an innovator product may have brand names. The next slide just shows you the choice of the generic or the innovator products that UNFPA may procure or has approved for procurement. And you can see on this slide that you actually have a choice of various products when you look at the different categories of hormonal contraceptives. This slide shows you the amount in savings that you may make for when you procure different generic medicines from different manufacturers, as well as the innovator ones from the different manufacturers. So just spend some time, go through that slide to see whether you make any savings, and then you can, when you do your planning, you can be able to use these names and choose on your planning tool to make as much savings as you can. In 2014, we have managed to deliver generic medicines to ministries of health and clients in over 18 countries. And some of the countries, you can see them highlighted there: the DRC, Zambia, Zimbabwe, Ethiopia, Somalia, and others. We just thought we would include a slide that would help you to understand the generic reproductive health medicines, because there may be some frequently asked questions that you may have asked yourself, but you probably don't have answers to. So we have provided a slide with some of those questions. For example, people may ask, are these generic reproductive medicines safe? The answer is yes. They have undergone the same assessment on safety and quality as the originator or innovator medicines. For UNFPA, we procure the medicines. These medicines should be WHO pre-qualified or approved in a stringent regulatory agency, or being recommended for procurement by an expert review panel. So in terms of quality, safety, and efficacy, these are assured. I'll hand over now to Chris to talk about the procurement aspect of AccessRH.
Thank you. I just want to proceed. And this is in continuation with what Priscilla most likely has touched earlier. So value for money, Priscilla has already discussed this. UNFPA's access and cost savings for its global purchasing power, competitive pre-negotiated prices, procurement contracts, and quality assurance expertise. Now, one thing that we should really be able to understand is that this word LTA. We've been using this, and most likely you would be able to see this in our catalog. So what is a long-term agreement or an LTA? An LTA is a long-term agreement, which is a written signed agreement between you, an organization, and the supplier for pre-selected goods or services, covering all the commercial terms, pricing, discount, payments, delivery and packing, and any other relevant, as well as general terms and conditions applicable to orders that may be issued against them. LTAs are usually based on a result of competitive standard exercise. Just to mention, some purpose of this long-term agreement is to establish best value for money, contracts and LTA in an efficient and cost-effective manner. Partnership with internal and external stakeholder, that is supplier, client, technical experts, UN agencies, and donors. Another thing is to effective category management strategy, efficient procurement and contract management process, as well as bridging the gap between program and procurement aspects. The benefit of using a UNFPA long-term agreement, is what I've mentioned earlier, is all products have gone through a competitive bidding process, better price, stability in supply costs, avoid application procurement process, direct ordering. Just to, it might be worth to mention that price saving, which is 15 to 98.7% from recent studies when compared to local prices in 4 countries. This is just like limited to only these 4 countries, which was being selectively sampled. And a time saving of 3 to 12 months required to conduct a bid process, since UNFPA already has done that, which we mentioned in our LTA. Now, some of the collaborations that we have made, and just to present a case, in 2012, World Bank donated $2 million to Vietnam's HIV/AIDS prevention project for procurement for male condoms. The government wanted special printing, special packaging, and assure quality in accordance with international standards. they decided to come to UNFPA for assistance. We purchased 42.5 million pieces worth, or $2 million US for the project in 2012. They were satisfied with the product and the service. When they received a new donation of 1.2 million from World Bank in 2013, they therefore approached UNFPA again to purchase the same type of special condom. Another worth a case, the Global Fund in China needed to procure a male condom and lubricant for 1.2 million US dollars to be distributed in 31 provinces in China. They have started on the process themselves, but decided in the end to approach UNFPA to carry out the procurement and distribution on their behalf. UNFPA China and TSP are collaborating in order to meet their demand. So pre-negotiated LTA saves our client 3 to 12 months of man-hours, reduced lead time for key commodities held in stock, and one can browse the extensive AccessRH catalog and use the prices for comparison with other suppliers as to guide and provide an estimate while creating a reproductive health procurement plan. Now this slide shows the different items offered by our inventory. We maintain inventory of key contraceptives and kits in order to expedite delivery in emergency situations or in cases of potential stackouts. For example, by ordering condoms from stock, you can reduce lead or delivery time by an average of 9 weeks compared to ordering from fresh production, which would go more than 6 months or more. Now this graph here shows the increase of quantities of condoms delivered from UNFPA inventory between 2011 to 2013. So you can see there's a huge margin from 2011, 12, and 13 with a total value of 600 million condoms from inventory, delivered from inventory. Now for this slide, it gives an overview on how to order from AccessRH. You can also find this in the website under order, then go how to order. Now just to go through all this, first of all, a client and implementing partner or a government agency would select an AccessRH catalog, or they would browse through there, complete a request for a pro forma invoice, and they would do this with their focal point. And then once it was been received, invoice, confirmation form, and everything, then this would be returned back to our client. Once it's been signed, everything is agreed, both on the prices, including the shipping methods, etc. Then we will be processing it. Transportation would come at the selected, at the agreed date, and then this would be cleared or being handed over to our implementing partner or the MOH or UNFPA if country office would be able to offer their assistance to them. Now, when to consider using AccessRH, if you are government NGO, it's a budget line item for RH supplies procurement. Prices paid for contraceptives are high compared to price in AccessRH catalog. Government NGO doesn't not have in-house procurement expertise to conduct tender concerns or incidents of faulty products or goods found in country. A country is graduating from USAID assistance, high level of fertility or maternal mortality in the country. The country does not have the manufacturing capacity to produce the needed contraceptive domestically. Previous tender contraceptives failed. Now, just to sum up, an LTA is developed from a fair and transparent process by going through appropriate solicitation method directed to a broad range of suppliers who are willing and has the capacity to comply with the requirements either in goods or through services they can provide. A great part of a product with an LTA is to make technical qualification, as what Siloy earlier has mentioned. A criteria which should be quality assured products, value for money, and greatly reduce the lead or delivery time for an item or good.
And that concludes our presentation, and we'll now hand it back over to Jamie and Ellen in DC.
All right, thank you very much. That was great. So we're going to take a few questions at this point, and Jamie's just going to talk you through how we'll moderate the question and answer part of this session.
Yes, so we have about 10 minutes remaining on the hour, and if you would like to ask a question now for any of the UNFPA panelists, we ask that you use either the Raise Your Hand feature on your GoToWebinar dashboard. If you click on the Raise Your Hand icon next to your name, we'll know that you would like to ask a question and we can unmute you. Alternatively, you may type in a question if you didn't want to ask it directly or if your connection is poor. So there is the question box on your dashboard will allow you to type in a question that we'll receive and we can read it out loud. So we've already gotten, it looks like, one question from Sarah Stratton for UNFPA, and she asks, can you indicate specifically where to find the fistula repair kits? Are they listed as such or included in other kits?
Sorry, can you repeat the question?
Yes.
Yes.
Yes, Sarah Stratton asks, can you indicate specifically where to find the fistula repair kits? Are they listed as such or included in other kits?
Yes, under the catalog, if they go to AccessRH.org/products, they come to the catalog, and on the left-hand side, they'll be able to see the different categories of products. And then there's something called medical kits. You would click into the medical kits, and you'll see there's midwife, RH kits. They removed it. Oh.
Now, if I may answer, the best way to do this is to coordinate with your focal point, because some of their countries doesn't have same specification or requirements for fistula kits or whatever kits that they want. Some countries would require that some items in a kit would be removed. So we can customize this, and in that way, it's better that to basically go directly to your focal point and not just solely rely on AccessRH. But this is just to give you an answer that this is a good just to prove. You can also search in the catalog under fistula kit, but I would really also highly recommend that you also talk to your focal point so that they can also advise you, and if ever you have a customized order for a certain kit.
Okay, thank you very much for that answer. Okay, Jamie, I think you can read the next question.
Yes, we had another question for UNFPA. You talked about supporting the harmonization of reproductive health medicines. Do you ever help support the registration of certain products for new indications? For example, misoprostol for postpartum hemorrhage.
We don't normally specifically focus on one product. So the strategies that we've been doing is supporting joint assessment. So if the manufacturer has submitted an application to these countries, then the product would be jointly assessed and the product may get registered. What we have done is we have extended this invitation to all the manufacturers of reproductive health commodities, including those of misoprostol, well, we don't have oxytocin, but all the other hormonal contraceptives and misoprostol, they were actually invited to submit their applications to these countries so to facilitate registration for them. But we don't specifically focus on one product.
Thank you. So the next question that we have here is, can a private organization order items through AccessRH?
No, they may not. We only work with governments and NGOs. The organization must be a nonprofit.
Thank you. So the next question we have is the lead time for kitted items, such as implant insertion kits.
Can you repeat the question? I'm sorry.
What is the lead time for kitted items?
It depends what's in the kit, I would assume.
And also the quantity.
And the quantity.
But normally for medical kits, we give an average of 12 to 16 weeks for production time and for packing. So of course it depends as well on the label, on the kit aspect. So and if it's something standardized that we have in stock or not.
Okay, thanks.
Great. We had another question here. Jamaica is in the process of integrating key aspects of the National HIV Program, specifically prevention, enabling environment, human resources, and monitoring and evaluation, into its family planning program. And in Jamaica, I'm not sure where this, where the participant is from, but he mentions that they promote dual method use and are scaling up integration. And he asks, how can we access capacity building to ensure reproductive health commodity security that satisfies both HIV and family planning programming?
Thank you very much for the question. Well, the capacity building that UNFPA does is focused on procurement of the RH commodities. Of course, it does touch on, though it's not directly touching on the issues of linking the reproductive health commodities using dual method, but it actually focuses on the procurement aspect of it. Another UNFPA branch would focus on the programming aspect of it. We only focus on the procurement aspect of it. I hope I've answered the question.
Yes, thank you. Another question that just came in, how do we add new contraceptive products to AccessRH? What is the process and the requirements?
Okay. This question can be in two ways. Because when we say new, are we talking about new combinations, or are we talking about new product manufactured by a different manufacturer? So I'll answer both questions. The first one is where it's a completely new combination that UNFPA has not procured, or it's not in UNFPA list. We can procure these medicines if they are eligible for WHO Prequalification, as well as those that have been recommended by the WHO Reproductive Health Division. We do not just add on any product without consultation with WHO and technical division. However, there may be a case where a country has a different combination in its essential medicines list. If it's in its essential medicines list, then this can be looked at and reviewed to see whether UNFPA can procure it specifically for that particular country, but it would not go into the catalog or on my AccessRH. The next one is when the combination or the product already exists and it's supplied already by other manufacturers. So that one is through the competitive bidding that normally undertake, that UNFPA normally undertakes. Thank you.
Thank you. And does that include, we had a follow-up, they were specifically asking about vaginal rings, you know, something that's not listed in your product catalog. How do you handle sort of new products as they enter the market?
Yes, like I said, we procure products that are eligible to WHO pre-qualification. So the information on the products that are eligible to WHO pre-qualification may be found on the WHO website, www.who.int/prequal. Then you'll be able to see the list of medicines that are eligible for WHO pre-qualification. Like I said, sorry.
And there's also on the UNFPA website, there's a section for suppliers, how to become a UNFPA supplier, which can give you the step-by-step processes that a manufacturer would have to go through in order to supply commodities to UNFPA.
So for a vaginal ring, currently it is not eligible for WHO pre-qualification. If the manufacturer may apply to WHO for inclusion of that commodity into the essential medicines list. And that process was open in December, and I think it's still open now. There is a website in WHO. If the participant is interested, we will send the link of the application for the application form on the WHO website, so they can apply for that product to be included in the WHO essential medicines list. That way, then UNFPA may procure the product. Thank you.
I think we have time for maybe one more. What help, if any, does UNFPA provide in getting commodities through customs?
Customs clearance?
We don't provide much support as such for non-NFPA clients. We do provide all the shipping documents beforehand. We provide all the flight details, the vessel details, but the paperwork NFPA unfortunately cannot assist with. We do say that if the partner or the client needs an assistance, they can contact our UNFPA locally, but UNFPA office locally. But as such, the custom clearance is responsibility of the client. UNFPA is only responsible for the shipment until it reaches the port of entry of the country. Thank you.
Thank you. All right, we'll try one more question and we'll log off. Do the generic products offered by UNFPA, such as Petagen, have the same shelf life as the originator's product?
I'll answer it as a general principle, and then I'll be specific to the product itself. A shelf life is determined by various issues. So a shelf life that is given by a manufacturer to their product may be different from a shelf life given by another manufacturer to a similar product. So it does not necessarily mean that if the innovator product has a shelf life of 36 months, then the generic product would have the same shelf life. They may have the same, they may have a longer one, they may have a shorter one. And I think for the DMPA by Helm, currently the shelf life is, I'm not sure exactly what it is, but it's probably less than the one for the other product. I can't remember. It's 3 years. But it does not necessarily mean that a generic product will have the same shelf life as the innovator product.
Okay, thank you very much. I think we've gotten through most of our questions, but I'm conscious of our time. So I just wanted to say thank you again to our colleagues over at UNFPA in Copenhagen for joining us today and taking the time to tell us more about AccessRH. Please feel free to tell your other country colleagues about our Spanish and French sessions that are coming up in next week. So with that, thank you again, and enjoy the rest of your day.